Connecticut Free CNA Practice Test with Answers 180 Questions Practice Exam. Question 1. What is a phobia? Option A. An intense fear of a specific object or situation. Option B. A loss of the sense of taste. Option C. A type of medication used for sleep. Option D. A state of total memory loss. The correct answer is option A. An intense fear of a specific object or situation. Phobias are irrational and excessive fears that interfere with daily life. Question 2. What is suicide contagion? Option A. A disease that causes suicidal thoughts. Option B. Exposure to suicide or suicidal behaviors within a group of people. Option C. A type of biological weapon. Option D. The fear of death. The correct answer is option B. Exposure to suicide or suicidal behaviors within a group of people. Contagion refers to the increased risk of suicide after exposure to others' suicides. Question 3. What is withdrawal syndrome? Option A. A type of physical exercise for the legs. Option B. A physical and medical response after stopping a regularly used substance. Option C. The process of moving a resident to a new room. Option D. A symptom of a common cold. The correct answer is option B. A physical and medical response after stopping a regularly used substance. Withdrawal occurs when the body reacts to the absence of a drug or alcohol it has become dependent on. Question 4. What does the abbreviation BPD stand for in mental health? Option A. Bipolar personality disease. Option B. Borderline personality disorder. Option C. Basic psychological development. Option D. Brief panic disorder. The correct answer is option B. Borderline personality disorder. Borderline personality disorder affects how a person feels about themselves and others. Question 5. What does the abbreviation PTSD stand for? Option A. Physical therapy and social development. Option B. Post-traumatic stress disorder. Option C. Permanent tissue and skin damage. Option D. Partial temporal seizure disorder. The correct answer is option B. Post-traumatic stress disorder. Post-traumatic stress disorder is a mental health condition triggered by a terrifying event. Question 6. What does the abbreviation OCD stand for? Option A. Overactive cardiac drive. Option B. Obsessive compulsive disorder. Option C. Oral care and dental hygiene. Option D. Orthopedic clinical diagnosis. The correct answer is option B. Obsessive compulsive disorder. Obsessive compulsive disorder involves patterns of unwanted thoughts and repetitive behaviors. Question 7. How is schizophrenia best defined? Option A. A loss of memory due to aging. Option B. A split mind or a brain disorder that affects how a person thinks and behaves. Option C. A temporary state of confusion. Option D. A type of physical paralysis. The correct answer is option B. A split mind or a brain disorder that affects how a person thinks and behaves. Schizophrenia is a chronic and severe mental disorder involving distorted reality. Question 8. In terms of mental health, what does mania refer to? Option A. A state of deep depression. Option B. Emotional highs and extreme energy or agitation. Option C. A fear of being alone. Option D. The inability to sleep. The correct answer is option B. Emotional highs and extreme energy or agitation. Mania is often a phase of bipolar disorder characterized by euphoria and hyperactivity. Question 9. True or false, alcoholism can be fully cured with the right medication? Option A. True. Option B. False. The correct answer is option B. False. Alcoholism is considered a chronic disease that can be managed but not cured. Question 10. What is the clinical definition of cognitive function? Option A. The ability of the body to move. Option B. Memory, thinking, reasoning, and the ability to understand. Option C. The process of digestion. Option D. The function of the heart and lungs. The correct answer is option B. memory, thinking, reasoning, and the ability to understand. Cognitive function relates to the brain's ability to process and retain information. Question 11. What is confusion? Option A. A state of extreme physical fitness. Option B. A mental state of being disoriented to person, time, place, or identity. Option C. The loss of the ability to walk. Option D. A normal part of the aging process. The correct answer is option B. A mental state of being disoriented to person, time, place, or identity. Confusion can be temporary or permanent and affects a person's orientation. Question 12. What is delirium? Option A. A slow and gradual decline in memory. Option B. A state of sudden, severe confusion and rapid changes in brain function. Option C. A type of physical seizure. Option D. A state of deep sleep. The correct answer is option B. A state of sudden, severe confusion and rapid changes in brain function. Delirium is often temporary and can be caused by infection or medication reactions. Question 13. What is dementia? Option A. A normal loss of memory that happens to everyone. Option B. The loss of cognitive function that interferes with routine activities. Option C. A temporary state of agitation at night. Option D. A physical injury to the spine. The correct answer is option B. The loss of cognitive function that interferes with routine activities. Dementia is a group of symptoms caused by various brain diseases, including Alzheimer's. Question 14. What is sundowning? Option A. When a resident feels better in the morning. Option B. The process of the sun setting. Option C. When signs and behaviors of Alzheimer's increase during hours of darkness. Option D. A type of skin rash caused by the sun. The correct answer is option C. When signs and behaviors of Alzheimer's increase during hours of darkness. Sundowning involves increased confusion and agitation in the late afternoon and evening. Question 15. What is fainting? Option A. A sudden loss of memory. Option B. A sudden loss of consciousness from a lack of blood supply to the brain. Option C. A type of physical exercise. Option D. A normal way to fall asleep. The correct answer is option B. A sudden loss of consciousness from a lack of blood supply to the brain. Fainting is often preceded by dizziness, sweating, or blurred vision. Question 16. What is a hemorrhage? Option A. A type of severe headache. Option B. The excessive loss of blood in a short period of time. Option C. A blockage in the digestive tract. Option D. A type of skin ulcer. The correct answer is option B. The excessive loss of blood in a short period of time. Hemorrhaging is a medical emergency that requires immediate pressure and intervention. Question 17. What is respiratory arrest? Option A. When the heart stops beating. Option B. When breathing stops but the heart continues to beat for a few minutes. Option C. A type of severe cough. Option D. The loss of the sense of smell. The correct answer is option B. When breathing stops but the heart continues to beat for a few minutes. Respiratory arrest requires immediate rescue breathing to prevent cardiac arrest. Question 18. What is a seizure? Option A. A sudden loss of the ability to speak. Option B. A violent and sudden contractions or tremors of muscle groups. Option C. A type of severe muscle cramp. Option D. A state of deep depression. The correct answer is option B. Violent and sudden contractions or tremors of muscle groups. Seizures are caused by abnormal electrical activity in the brain. Question 19. In an emergency, what is shock? Option A. A state of being surprised. Option B. When organs and tissues do not get enough blood. Option C. A type of electrical injury. Option D. A sudden loud noise. The correct answer is option B. When organs and tissues do not get enough blood. Shock is a life-threatening condition that requires immediate medical treatment. Question 20. What is sudden cardiac arrest? Option A. When the heart stops suddenly and without warning. Option B. A slow decline in heart function over years. Option C. A type of chest pain. Option D. When a person stops breathing but their heart continues. The correct answer is option A. When the heart stops suddenly and without warning. Sudden cardiac arrest results in immediate loss of consciousness and requires cardiopulmonary resuscitation. Question 21. What does the abbreviation AED stand for? Option A. Advanced Emergency Device. Option B. Automated External Defibrillator. Option C. Aged and Elderly Department. Option D. Airway and Esophagus Drain. The correct answer is option B. Automated External Defibrillator. An automated external defibrillator is used to deliver a shot to the heart during cardiac arrest. Question 22. What does the abbreviation BLS stand for? Option A. Basic Life Support. Option B. Blood Level Survey. Option C. A Breathing and Lung Safety. Option D. Body Language Study. The correct answer is option A. Basic Life Support. Basic life support includes procedures like cardiopulmonary resuscitation and choking relief. Question 23. What does RRT stand for in a hospital or facility? Option A. Resident Recovery Team. Option B. Rapid Response Team. Option C. Radiology and Radiation Therapy. Option D. Routine Recording Task. The correct answer is option B. Rapid Response Team. A rapid response team is called when a resident shows signs of severe clinical decline. Question 24. What is the ratio of chest compressions to rescue breaths during adult cardiopulmonary resuscitation? Option A of 15 compressions to 2 breaths. Option B 30 compressions to 2 breaths. Option C 10 compressions to 1 breath. Option D 50 compressions to 5 breaths. The correct answer is option B. 30 compressions to 2 breaths. The standard ratio for adult CPR is 30 compressions followed by 2 breaths. Question 25. What is a thrombus? Option A. A blood clot that has broken off and is traveling. Option B. A blood clot that is still attached to the wall of a vessel. Option C. A type of muscle tumor. Option D. A blockage in the airway. The correct answer is option B. A blood clot that is still attached to the wall of a vessel. A thrombus can block blood flow and lead to serious conditions like a heart attack. Question 26. What is an embolus? Option A. A blood clot that stays in one place. Option B. A blood clot or object that has broken off and is traveling through the blood. Option C. A type of severe skin rash. Option D. A sudden loss of memory. The correct answer is option B. A blood clot or object that has broken off and is traveling through the blood. An embolus can travel to the lungs or brain, causing life-threatening complications. Question 27. What is anaphylactic shock? Option A. A type of shock caused by blood loss. Option B. A severe and life-threatening allergic reaction. Option C. A state of confusion caused by a stroke. Option D. The response of the body to extreme cold. The correct answer is option B. A severe and life-threatening allergic reaction. Anaphylaxis causes swelling of the airway and requires immediate medication. Question 28. What is a cerebrovascular accident? Option A. A serious car accident. Option B. The medical term for a stroke. Option C. A broken bone in the spine. Option D. A type of heart attack. The correct answer is option B. The medical term for a stroke. A cerebrovascular accident occurs when blood flow to the brain is interrupted. Question 29. What is a partial seizure? Option A. A seizure where the person loses total consciousness. Option B. A seizure where only one part of the brain is involved and consciousness is maintained. Option C. A seizure that lasts for only 1 second. Option D. A seizure that only affects the legs. The correct answer is option B. A seizure where only one part of the brain is involved and consciousness is maintained. During a partial seizure, the person may experience sensory changes or involuntary movements. Question 30. What is a tonic-clonic or grand mal seizure? Option A. A seizure where the person remains fully awake. Option B. A seizure involving loss of consciousness and violent muscle contractions. Option C. A seizure that only involves the eyes. Option D. A seizure caused by low blood sugar. The correct answer is option B. A seizure involving loss of consciousness and violent muscle contractions. Tonic-clonic seizures are the most common type of generalized seizure. Question 31. What are advance directives? Option A. Instructions on how to perform a surgery. Option B. Documents stating a person's wishes about healthcare when they cannot make decisions. Option C. The rules and regulations of the facility. Option D. A type of medication used for pain. The correct answer is option B. Documents stating a person's wishes about healthcare when they cannot make decisions. Advance directives include living wills and durable powers of attorney for healthcare. Question 32. What is the goal of palliative care? Option A. To perform aggressive surgeries to find a cure. Option B. To relieve or reduce the intensity of uncomfortable symptoms without a cure. Option C. To provide physical therapy for a full recovery. Option D. To help a resident move to a new home. The correct answer is option B. To relieve or reduce the intensity of uncomfortable symptoms without a cure. Palliative care focuses on quality of life and comfort for those with serious illnesses. Question 33. What is post-mortem care? Option A. Care given to a resident right before they die. Option B. Care of the body after death. Option C. The process of reading a person's will. Option D. A type of spiritual counseling. The correct answer is option B. Care of the body after death. Post-mortem care involves cleaning and positioning the body with respect. Question 34. What is reincarnation? Option A. The belief that a person only lives once. Option B. The belief that the spirit or soul is reborn in another form of life. Option C. A type of medical treatment for the elderly. Option D. The process of a body decaying. The correct answer is option B. The belief that the spirit or soul is reborn in another form of life. Religious and cultural beliefs about reincarnation can affect how a family views death. Question 35. What is rigor mortis? Option A. A state of deep sleep after death. Option B. The stiffness of skeletal muscles that occurs after death. Option C. A type of infection that causes skin to rot. Option D. The process of the heart stopping. The correct answer is option B. The stiffness of skeletal muscles that occurs after death. Rigor mortis makes the body difficult to move and typically begins a few hours after death. Question 36. Which statement best describes hospice care? Option A. Care that is focused on curing a terminal illness. Option B. Care for dying persons and their families that focuses on comfort and dignity. Option C. Care that is only provided in a hospital intensive care unit. Option D. A program designed to help residents return to work. The correct answer is option B. Care for dying persons and their families that focuses on comfort and dignity. Hospice care is typically for those with 6 months or less to live. Question 37. In the stages of dying, what is the denial stage? Option A. The person is calm and at peace. Option B. The person refuses to believe that he or she is dying. Option C. The person asks why me and is very upset. Option D. The person makes promises to God for more time. The correct answer is option B. The person refuses to believe that he or she is dying. Denial is a common initial defense mechanism when facing a terminal diagnosis. Question 38. In the stages of dying, what is the anger stage? Option A. The person is sad and withdrawn. Option B. The person asks why me and may be difficult to care for. Option C. The person accepts that death is near. Option D. The person refuses to talk to anyone. The correct answer is option B. The person asks why me and may be difficult to care for. Anger is a normal response to the loss of control and the end of life.